You've tried the white noise machine, maybe the app, maybe the supplement someone recommended online. Maybe you even saw a doctor and they told you just have to live with your tinnitus. But you're still struggling, and every failed attempt makes you feel a little more afraid that the ringing is just going to own the rest of your life. I'm Dr. Layne Garrett, founder of Timpanogos Hearing and Tinnitus here in Utah. I've specialized in tinnitus treatment for over 20 years. What drives me crazy is watching people cycle through treatments that fail, not because tinnitus is untreatable, but because they were given the wrong treatment or the right treatment with no real plan behind it. Today, I want to talk honestly about the 3 most common reasons tinnitus treatments don't work and what actually does work instead. There's a lot of noise around tinnitus, no pun intended. Audiologists who hand out white noise machines and call it done. ENTs who run a hearing test find nothing structurally wrong and say there's nothing more they can do. Wellness influencers are selling supplements and apps are out there promising relief in 15 minutes a day. Most of these people aren't lying to you, they're working from an incomplete model of what tinnitus actually is. Too much tinnitus care is still a one-size-fits-all. One sound machine, one handout, one follow-up visit, no real measurement. The assumption is that if you manage the sound, the ringing, the buzzing, the hissing, you've solved the problem. But tinnitus distress isn't primarily about the sound. It's about how your brain and nervous system have learned to respond to it. And that's a totally different problem. Maybe you're thinking, I've tried CBT. I did sound therapy. It just didn't work for me. But are you sure it didn't work, or was it never actually designed around your specific tinnitus? Did anyone measure the pitch and loudness of what you were hearing before starting treatment? Did they look at your sleep, your anxiety, your hearing, and build a plan connecting all of those things? Did they track whether you were actually improving over time? Or did someone hand you that sound machine, wish you luck, and schedule a follow-up appointment 3 months down the road? That's not a plan. That's just a guess. What if the problem isn't that your tinnitus is untreatable? What if the problem is that no one actually measured the version of tinnitus you have? Quick pause. If this is the kind of straight answer you've been looking for, subscribe. I make videos every week on tinnitus, hearing loss, and how to find care that actually measures outcomes instead of guessing. 2 videos a week, no fluff. I saw a patient not long ago who came in with a bag, literally a bag, with white noise machines, 2 different apps on his phone, and 4 supplement bottles. He'd been trying to figure this out for years. He wasn't careless and he didn't want to give up. He just had never had anyone sit down with him and figure out what was going on with his tinnitus, what pitch it was, how it was affecting his sleep or his concentration and his relationships, whether anxiety was amplifying it. Nobody had measured anything. We did a full workup, built a plan around what we found, and within 3 months, his tinnitus functional index score had dropped enough that he told me he'd gone back to reading before bed, something he'd stopped doing entirely because the tinnitus was unbearable when it was quiet. That's what this video is about. Not a better supplement, a better starting point. The first reason tinnitus treatment fails is treating the sound instead of the system. Sound therapy like white noise machines, masking apps, and background sound can be a useful part of treatment. The original purpose was to reduce the contrast between your tinnitus and surrounding sound, which makes it easier for your brain to start treating the tinnitus as a threat. That's a real, meaningful role. What it is not is a complete treatment plan all on its own. A Cochrane review, the gold standard for evaluating medical evidence, looked at sound therapy as a standalone treatment for tinnitus. The data did not support it as a sufficient standalone intervention. The clean takeaway isn't that sound therapy doesn't work, it's that masking alone is not enough. Here's why. Research using brain imaging has found that chronic tinnitus involves abnormal connections between the auditory cortex and the limbic system. That's the part of your brain that processes fear and threats. In plain terms, your brain has filed your tinnitus under a danger. A sound machine running on your nightstand doesn't change that filing, it just temporarily covers it up. Changing that response requires retraining how your nervous system reacts to the tinnitus, not just trying to cover it up. The second reason treatment fails is hope-based care, chasing the next supplement, the next device, the next app that promises relief without requiring anything from you. I'm not dismissive about this. When you're exhausted and desperate, hope is rational. And I've seen patients spend real money, sometimes thousands of dollars, on products that made confident promises and delivered almost nothing. The American Academy of Otolaryngology's clinical practice guidelines specifically recommend against the routine use of supplements like ginkgo biloba, zinc, and melatonin for persistent bothersome tinnitus. Not because they're dangerous, because the evidence is not strong enough or consistent enough to recommend them across the general tinnitus population. Does that mean tinnitus supplements are useless for everyone? No. If someone has a documented B12 deficiency, correcting it might genuinely help. Context matters. But a bottle off the internet is not a treatment plan. What I see more often than I'd like, patients who come in over 18 months going through supplements, apps, and passive fixes before coming to see us, and I understand why. Passive is easier, but tinnitus distress is not a passive problem. It requires active nervous system retraining, and that takes real effort over time. The third reason, and the one that matters most, is that treatment was started without actually understanding what your tinnitus was. Before we recommend anything at our clinic, we do a full diagnostic workup, comprehensive audiometry, including extended high-frequency testing, otoacoustic emission test, psychoacoustic testing, meaning we actually measure the pitch and loudness of your specific tinnitus, not just asking you to describe what you hear. We use validated outcome questionnaires like the Tinnitus Functional Index and the Tinnitus Handicap Inventory to track how much distress you're experiencing across different areas of your life: work, sleep, concentration, and relationships. And we assess anxiety and sleep directly because those aren't separate from tinnitus. They're all part of the same system. Now, why does all of that matter? Newer research is moving in the direction clinicians have suspected for years. Tinnitus patients are not the same. Audiological data, distress scores, sleep, anxiety, loudness tolerance can help predict who's likely to respond to different treatment approaches. Treating without assessing is guessing, and guessing is why treatment fails. One practical question worth asking any clinic you're considering going to: do they redo outcome measurements at follow-up visits? Not asking how you're feeling, but actually scoring using the same validated tools to see whether your distress is measurably improving. The answer is no, they're not tracking outcomes, they're hoping. So what does effective treatment actually look like? It starts with that real assessment we were just talking about. Measure the tinnitus first, treat it second, every time. It includes addressing hearing loss if that's present, because your brain is partly generating the tinnitus in response to reduced auditory input. Properly hearing aids are often one of the most powerful tools. And properly fitted means verified with real ear measurements, not just does that sound better. It includes cognitive behavioral therapy. The research on this is as solid as anything we have. A 2025 summary from the World Tinnitus Congress confirmed that both audiologist-delivered and psychologist-delivered cognitive behavioral therapy produce meaningful reductions in tinnitus distress. CBT doesn't eliminate the sound, it changes how your nervous system responds to it, which is what actually reduces your suffering. For some patients, we may also include treatments like Layne, an FDA-approved bimodal neuromodulation device that pairs sound with tongue stimulation to encourage changes in how the nervous system responds to your tinnitus. And it involves tracking outcomes over time, not just asking how you feel, but re-administering validated questionnaires to see whether you're actually getting better. That's what comprehensive tinnitus care looks like. Not a single tool, a system built around you. And I need to name something directly because people who've been through failed treatment often carry this quietly. It's the exhaustion of the nights where the silence feels louder than anything else. It's avoiding quiet rooms so you leave the TV on just to get through dinner. It's the slow withdrawal from things that used to restore you, things like reading, hiking, or sitting in the backyard, because the quiet that used to feel peaceful now feels like a threat. Maybe someone told you this is just what life is like now. That's not something I'm willing to accept for my patients without a fight. And if you're watching this, odds are you aren't either. The reason your tinnitus treatments haven't worked in the past is almost certainly not that tinnitus is untreatable. It's that masking only treats the wrong thing. Passive fixes skip the actual work. And without a real assessment, no one can build a plan that matches your specific situation. Drop a comment below. What treatments have you already tried and what happened? Your experience helps other people watching this to figure out what their next step should be. And if you want to go deeper on evidence-based tinnitus treatment, we have a free learning center online with detailed guides on what actually works and why. No email required, just information. You can find a link in the description. And if you're here in northern Utah and you're ready to start with a real assessment rather than another guess, you can schedule an appointment in one of our clinics along the Wasatch Front. You can find a link to do that in the description as well. Thanks for watching.